Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern Ireland Assembly plenary programme signed. This is the Northern plenary.
Thank you. Please take your seats. Members, just some opening remarks. As Speaker of this Assembly, I am delighted to officially welcome you all to Parliament buildings and to the first Disabled People's Parliament of its kind throughout these islands, and we believe much further afield. I am pleased to chair this debate as it gives people with disabilities the opportunity to raise their concerns directly with the decision makers. The Assembly makes laws for all of our citizens, and it is essential, therefore, that everyone can have their say. Today's event is a way for you to do that, and it is also a very fitting way for the Assembly to mark the International Day for People with a Disability. I spoke last year on the 25th anniversary of the passing of the Disability Discrimination Act, highlighting the need for politicians and this Assembly to be more proactive in engaging with people with disabilities. Therefore, I am pleased to host the first sitting of the Disabled People's Parliament, particularly because the event was planned in partnership with a range of organisations that support people with disabilities. I trust that this joint approach has helped you feel valued and that your contribution today will bring the change that we all want to see, that everyone here can enjoy the same rights, access and entitlements. I look forward to listening to your concerns and hearing how the Minister plans to address the issues raised by yourselves. So if everyone is ready, then we will commence the agenda proper for today. Moving on to order paper item number 1. You'd say number 2, we'll stand corrected. The item of business to be debated today is a motion on the United Nations Convention on the Rights of People with Disabilities. Clerk, please read the motion.
That this Parliament calls on the First Minister and Deputy First Minister to commit to fully incorporating the United Nations Convention on the Rights of Persons with Disabilities into legislation in Northern Ireland.
Thank you. And 2 hours have been allocated for this debate. The proposers of the motion will have 10 minutes to propose and 10 minutes to wind. All other speakers will have 5 minutes. As we go through the debate, I will formally introduce each speaker and outline which article of the United Nations Convention each contributor wishes to discuss. Mr Tony O'Reilly will open the debate and he will make his contribution remotely. Can Mr O'Reilly be brought onto our screens, please? And I now call Tony O'Reilly to formally move the motion and to open the debate. Tony, the floor is yours.
Thank you, Mr Speaker and Minister and esteemed colleagues from the Disabled Persons Human Rights Movement. I move forward the motion on behalf of the North West Forum of People with Disabilities for the motion to be heard. Mr Speaker and members, the incorporation of the UN Convention on the Rights of Persons with Disabilities into the Book of Law of Northern Ireland is a critical proposal that disabled people right across Northern Ireland would like to see, for a number of reasons. Firstly, it tells the people of Northern Ireland that disabled people are important, that our human rights are important, and that we are to be respected and valued. This is a fundamental principle of the UN Convention on the Rights of Persons with Disabilities. The principle of dignity, the principle of valuing and respecting the views of disabled people in terms of our individual lives, but also engaging with decision makers. This event itself is an example of the Convention of the Rights of Persons with Disabilities being put into practice. Article 4 makes clear that disabled people should be involved in the decision making in the governance of the various countries that they live in. Today is a perfect example of that. Article 29, the right of disabled people to participate in public life, is another example of that. And I'd like to thank the staff of the Northern Ireland Assembly and you, Mr Speaker, and the Minister, and all who are in attendance today to hear what we have to say. The Convention on the Rights of Persons with Disabilities came into being on the 13th of December 15 years ago in 2006. The UK government, along with the Northern Ireland Executive and the other devolved governments, signed up to this convention in 2009. In doing so, the countries agreed in principle to sign up to the protection of disabled people's human rights. And fundamentally, core to all of these rights is the principle of dignity, and ensuring that disabled people are treated with fairness and respect and are valued the same as all others within society. Incorporation of the UN Convention is it would be an historical moment for the people of Northern Ireland, because, as I've said earlier, it says that disabled people and their issues are important. You are going to hear today from a whole range of speakers across Northern Ireland, all of them disabled people or parents of children with disabilities, giving you their experiences and telling you why the UN Convention on the Rights of Persons with Disabilities is important to them. But let me tell you, the UN Convention on the Rights of Persons with Disabilities recognises that first and foremost, disabled people are human beings entitled to fundamental human rights. It sets out human rights standards that disabled people are entitled to and should be entitled to. This is a global agreement. This agreement is monitored by 18 human rights experts, and they monitor the progress of how we are doing, of how all the countries are doing in progressing the rights of persons with disabilities throughout the globe. These 18 human rights experts are all disabled people. And one thing you will note about the UN Convention, the Convention is from a disabled person's perspective. So it's at the very heart of it, it's disabled people who have designed it, who have written it, who have drafted it. And fundamentally, it states that disabled people are human beings, not people with special needs, not vulnerable adults. We are human rights holders, and this is why it's important that we state that publicly and incorporate it into law. Yes, there have been challenges since the UK government and the Northern Ireland Executive and Assembly signed up to the Convention in 2009. Yes, the UN Committee have made 88 criticisms of the UK government's approach to the Convention. And there have also been an investigation on particular rights, the right to independent living, the right to employment, and the right to an adequate standard of living and social security, which says there have been systemic violations of our human rights, and that the UK government, along with the devolved governments, including the Northern Ireland Executive and Assembly, should do more to protect the human rights of disabled people. But it is not all doom and gloom. There has certainly been significant progress. The North West Forum had the privilege of standing in this very Assembly, in the Senate chamber, on the 2nd of April 2019, along with ILF Scotland, ILF Northern Ireland, the Centre for Independent Living, ILF users, arguing for the reopening of the Independent Living Fund and the proper enactment of Article 19, the right to independent living. I am delighted to say on this historic and wonderful occasion that progress has been made in that regard, and that government are listening to what disabled people are saying in this very important area of our rights. I'm also delighted to say that there has been progress in terms of the government's intent within the disability strategy to develop a regional disability forum, which will include directly disabled people themselves articulating their views to decision makers and to government about how government's policies and recommendations should be implemented to affect them. Yes, there are significant gaps and progress needs to be made. And the only way for that progress to be made is if the UN Convention on the Rights of Persons with Disabilities is incorporated into law. It's been considered in Scotland, and it has also been considered in Wales. And other countries like Sweden, Norway, and throughout Europe and throughout the world have also incorporated the convention and other conventions, such as the Conventions on the Rights of the Child. It's nothing to be afraid of. We often think, oh, we can't do it because it would make our legislation different. Well, the legislation is different throughout the United Kingdom. The legislation is different in Wales and Scotland and in England and Northern Ireland. So that argument doesn't apply. There's also the fear and anxiety that it's going to cost a whole lot of money, or it's going to be too technical and it's asking too much because historically we don't sign up to the convention. That isn't true. Human rights by its very nature is evolutionary. It's gradual. By putting it into law, it means you're recognising that disabled people are important, and you can still take time to progress the implementation of the convention as and when it needs to be done. It doesn't mean that everything has to be done today. It's a gradual evolution. It's a gradual progress. It's not something that we're expecting all of a sudden you incorporate the UN Convention and all's rosy in the garden. Disabled people, let me assure you, and the disabled people you're going to hear from today on each and the very articles are very pragmatic. We have come through many barriers and many challenges, discrimination and all sorts of indignities. We know things take time, but by incorporating the UN Convention on the Rights of Persons with Disabilities into the Book of Law and saying to the people of Northern Ireland and showing leadership to the wider UK and indeed to the people across this whole island, you were saying that you are willing to take the UN Convention on the Rights of Persons with Disabilities very seriously indeed. Mr. Speaker, thank you for this opportunity to speak and the opportunity to make this presentation to you today. I now will give you the opportunity to allow other speakers to come in and to talk to you about the particular articles set out within the Convention within the context of their experiences, and hopefully highlight how important it is the incorporation of the UN CRPD Convention is to disabled people in Northern Ireland. And also, Mr. Speaker, just to make you aware, the UN Committee have made clear and have asked in their recommendations that the incorporation of the UN CRPD on the rights of persons with disabilities must happen, and encourages all countries who have signed up to this wonderful treaty to do so. Thank you.
Thank you, Cormac. Tony O'Reilly, thank you, Tony, for moving the motion this afternoon. And our next speaker I call Amanda Paul. Amanda will discuss Article 19 on health and independent living. Amanda.
Thank you, Mr. Speaker. Hi, my name's Amanda. I'm affectionately known amongst my disabled peers as the baby. Sadly, this is not because of my age. I, among my friends, am the most recently disabled. There was a time not so long ago when I could walk, run and skip. Well, maybe the skipping is a bit of an exaggeration. A time when I had choice and control over my life, when I was independent and as free as you could be, when I enjoyed my life and my life was mine. Then, in a blink of an eye, overnight literally, everything changed. Suddenly, I was disabled. I was prepared for it. I was not prepared for it. I had not expected it. I had no idea what was ahead of me. We don't, do we? Sorry, I need to put the glasses on. Any of us who are not disabled yet really haven't a clue of what might be like, what might be just round the corner. Unknown to me, I had a hereditary condition, and to cut a long story short, one day I was able to walk unaided. the next day I couldn't. And so began the process to regain the choice and control over my life and to get my independence back again. To begin with, my housing needed addressing. I was confined to the kitchen as I was unable to access any other area of my home. I had a recliner chair there and I ate. I washed, I dressed and I slept there. This situation continued for over 3 years with very little external support or assistance. My district nurse was my one godsend during those horrible years and did all in her power to ease my situation. A so-called care package was arranged after several months, and my husband and I thought, great, now we're getting somewhere. But this amounted to the care worker rushing in and out again without providing the assistance that I actually needed. Having worked all of my life, I had never been in a situation of dependence like this. I didn't know how the system worked or how to get the wheels in motion, so the waiting continued. In desperation, I decided to seek the help of an MLA. She held the appropriate authorities to account for the past and very quickly got me a positive way forward. Why should someone have to go through this excruciatingly long, drawn-out, demoralising process, which amounts to downright cruelty, to be able to bring a life back on track? Although things began to move forward, it still took another year for the process to be at a point to even allow the building work to commence. This process, another story, was a nightmare. During the period I was living in the kitchen, I took very ill with septicemia, helped in no way by my living conditions. Thankfully, the ambulance service responded very quickly and got me to the hospital within that magic hour. I will always remain grateful to them. The problem started the day after I was admitted. On the main ward round, the consultant and all his medical support staff came round the bed. The consultant talked back and forward to his staff explaining why I was in. The consultant then addressed me and in his words, I quote directly, "Due to your disability and your weight, if things go south from here, I see no point in pummelling your chest. I think it's best we put a DNR on you." He turned around, said thank you and walked away. I was left reeling that someone could pronounce a death sentence on me without discussion or recourse. I was in tears, wondering if I was going to die. Is this the value of a disabled person's life? Until disabled people have a right to live independently and have full and complete protection under the law, others who think they know better, who think disabled people have no rights, who don't see enough disabled people out and about because our society, our streets, our buses, our houses, our shops, our schools, our workplaces still do not include us, do not accept us fully. These others will continue to consider us invalid and worth nothing. Eventually, I got to know about direct payments and grabbed the opportunity to benefit from it with both hands. It gives me some choices and some control over my personal care. It allows me to employ my own assistants to meet my basic needs, helping with dressing, washing, but there is no funding provided for me outside the home. For example, if I want to buy a Christmas present for my husband, or even something as simple as a birthday card, I have to ask him if he can take me to the shops to do so. I would love nothing more than being able to give my husband a simple surprise. I would love to be able to do that, and that would make independence real for me. I know opening up the Independent Living Fund to more disabled people is under consideration, but the answer seems to be a long time in coming for me. Some of my disabled peers benefit from the Independent Living Fund already and have done so for some years. I am well aware that the Independent Living Fund would certainly assist in doing these simple things that transform my existing into my living. I have a caring and loving husband to assist me, and although I would not know what I would do without him, I would love him to be more of my husband, less of my carer, and less of my taxi driver. This is just a brief outline of my most recent life. It is completely impossible to cover all these issues in a short talk. Thank you for your time today and for listening to some of my story over the past few years. I hope telling my story has a benefit for all those who find themselves in a similar or a worse situation than myself. Thank you once again.
Thank you, Amanda, Paul, for your contribution. Very poignant indeed. Our next speaker, can I call Christine and Lelia McClements to discuss Articles 7, 9 and 21 on children, accessibility and being included in the community. Christine and Lelia are making their contribution remotely. Can both be brought onto our screen, please? Thank you. So can I now invite Christine and Lelia to make their contribution?
Good afternoon, everyone. My name is Christine McClements and I am mummy and carer to my lovely daughter Lilia here. Lilia is now 13 years old and getting big. At age 8, Lilia received her official diagnosis of STX-BP1, which is a rare genetic disorder that causes epilepsy and physical and learning disability. Lilia has profound and multiple learning disability and is non-verbal and a full-time wheelchair user. She needs full assistance with all of her daily care needs. More importantly, Lilia is a very happy, sociable, laid-back child. She enjoys getting out and about in busy, loud spaces where there's lots to do and see. As Lilia's parents, we wish for Lilia to lead a worthwhile, valuable and meaningful life on her own terms to the best of her ability, which is very much the same as we wish for Lilia's two sisters. But what is standing in the way of this for Lilia? Our experience is that Lilia was born into a society that often only paid lip service to the full equality and inclusion of disabled children and adults. As a severely disabled child, Lilia was expected to be changed on a disgusting public toilet floor from the point in time when she outgrew the standard baby changing unit. And she was excluded from playing in play parks alongside her sisters and other children, as her play needs as a disabled child weren't even a consideration. A few times people have said to me that in years gone by you wouldn't have seen a child like Lilia out and about. I think in those days disabled children were just expected to go to their special schools and back home and not really trouble the rest of society very much. Well, I'm here to spell out that those days are well and truly gone, and families like ours will not keep our beautiful, vibrant children away from the world. We expect full inclusion and nothing less will do. Lilia is equal to every other child in Northern Ireland and beyond. However, all too often, our public bodies fail to take account of the very existence of severely disabled people in the provision of public services, like the provision of new community buildings, play parks and public toilets, and participation in summer schemes, social and recreational activities and events. Disabled people can be treated like optional extras, where their basic access needs will only be accommodated if the budget can stretch that far once everybody else's needs and wants have all been met. In terms of the use of public money, disabled people can be viewed as budget busting and an extra cost burden rather than full and equal members of society. Public money should bring opportunities and benefits for all citizens, leaving no one behind, least of all those known to be the most socially isolated, disadvantaged, marginalised and discriminated against in our society. Public money must always work for the public good of all in creating a more equal, fair, shared, diverse and inclusive future for all citizens. When Lilia was 5, I started campaigning for a fully inclusive built environment, in particular relating to play parks and provision of changing places toilets, which are fully accessible toilets with sufficient space for a wheelchair user, assisted by carers, and including equipment like an adult-size changing bench and hoist. 8 years later, and I regularly come across publicly funded, new build and refurbished so-called state-of-the-art community buildings that fail to meet the safe, dignified and hygienic toileting needs and rights of disabled people by not providing a changing faces toilet. And also new highest category destination play parks that provide grossly inequitable play opportunities for disabled children, particularly wheelchair user children. Our local councils, funded by government departments, continue to use public money to further hardwire more exclusion, disadvantage and discrimination of disabled people into our society for another generation. This is wrong. I'm therefore calling on government departments and public bodies to fulfil their duties to disabled people and carers by adopting fully inclusive design principles, standards and practices into all publicly funded community infrastructure, development and services. Every new build, publicly funded community building where toilets are included should provide changing faces toilets to respect the toileting needs and rights of disabled people. And every new play park should provide an equitable range of play equipment to respect the play needs and rights of disabled children. These are basic things. A fully inclusive built environment is the foundation of a fully inclusive society, because nothing that happens in a public building or space can be available and welcoming to everyone if that building or space denies people access and equality within it. Public bodies should not only be the followers of best practice for the equality and inclusion of disabled people, they should be leading the charge. How else can they expect to have the moral authority to lead others on disability issues if they are not themselves exemplifying the full equality of disabled people in everything they do? I don't know what the future holds for Lilia, but one thing I'm absolutely sure of is that my disabled daughter will not achieve the equality, rights and inclusion that I want for her until those charged with providing public services recognise that her place in society is not on a public toilet floor or sitting on the sidelines looking on as other children play. No disabled child should start their life with this indignity, inequality and exclusion. Thank you so much.
Thank you to Christine and Lilia for that contribution, and we move on to our next speaker, and I call Dermot Devlin. Dermot will discuss Article 27 on employment. Dermot.
Thank you, Mr. Speaker, and I'm delighted to be here speaking on the first disabled person parliament here at the Northern Ireland Assembly, especially here on International Day of Persons with Disability. My name is Dermot Devlin, and I'm from Greencastle, County Tyrone. I am a part-time employee of Home Enterprise. I've been employee there since 2002 and started working under a 6-month contract under the support from the Work Track programme, which has now ceased. I get support from UCL. As a disabled person, I've been very fortunate to have found and kept the employment I have there long term, and I'm very happy to be there. But I know that many others who are disabled aren't as lucky. In Article 27, under the UNCRPD, states countries recognise the rights of deaf and disabled people to work on an equal basis with others. This includes the right to opportunity to gain a living by working freely. Children are accepted in the labour market and work environment that is open, inclusive and accessible to deaf and disabled people. Countries shall safeguard and promote the realisation to the right to work, including those who require a disability during the course of employment, take appropriate steps, including through legislation. The employment rate for deaf and disabled people in the North is the lowest of the 4 countries within the UK, and the disability employment gap is the largest. The employment rate here for the deaf and disabled people is 38.1%, compared to 8.3% for non-disabled people. This is unacceptable and a shameful gap of 42.2%. This is stark contrast to other parts of these islands. In GB, the employment rate is well above 50%, and the employment gap is 26 percent points. It is immoral that this is allowed to continue here in Northern Ireland, and it is imperative that you, the MLAs and ministers here today, through the Assembly, bring the UN CRPD into effect for Northern Ireland. With my discussions with many deaf and disabled people, they find it increasingly difficult to get past the application stage, as many potential employers look unfavourably towards us. They wrongly see the financial burden that they perceive that we will bring. Some deaf and disabled people have experimented by taking two identical applications, one stating that they are disabled, the other one not. The honest application rarely reaches the interview stage. Deaf and disabled people are statistically almost twice as likely to be unemployed compared to those who are non-disabled. I have been very fortunate to get a 6-month contract at Home Enterprise, which has developed into a permanent contract, sustained now for 19 years. Many deaf and disabled people are continuously placed in 6-month placements and not receiving contracts at the end of it. We deserve a full, meaningful employment with competitive wages. Deaf and disabled people are viewed as cheap labour on short-term contracts to fulfil menial tasks. The UN CRPD will protect against this practice and ensure that we are on an equal footing as non-disabled people and not discriminated against when seeking meaningful employment which is secure. When in employment, deaf and disabled people still face many barriers, which places us at a disadvantage over non-disabled people. Many office spaces are not designed to meet the needs of us. Sufficient floor space and training space is often lacking for many. And other factors could be wrong seating or workstations for disabled people who have chronic pain and adds to their pain. Even a wrong telephone for those who have hearing loss would be able to work with a Bluetooth option for hearing aid or volume control. Deaf and disabled people fear, because their health can fluctuate, that many employees will see it as an opportunity to terminate our contract and not being able to fulfil their duties. In many cases, this has happened. Deaf and disabled people want to work, can work, but their health needs to be accounted for in contracts. The UN CRPD will safeguard our jobs and allow for flexibility within our contracts that will suit both employers and employees. Deaf and disabled people contribute £274 billion to the UK economy annually, so we're an important part of society, but we find it hard to break out of the welfare catch-22. Like myself, a lot of the deaf and disabled people are on part-time contracts and unable to increase our working hours, as it would put us into poverty. Life costs us, on an average, £583 extra per month, more than non-disabled people. 24% of families with deaf and disabled children, it costs an extra £1,000 per month. We are stuck within the benefit system, as it will not pay us to leave. Without the Northern Ireland Assembly taking the UN CPRD and implementing it into our laws, deaf and disabled people will continue to be left behind. In the North, we have skills, we have the knowledge, and we have the determination to work, but we need to be allowed to perform to the best of our potential abilities, such like non-disabled people are. Under Article 27, the UN CRPD offers us a level playing field in work and employment. So remember, nothing about us without us, and without us, the Northern Ireland economy and workplace will not survive. Thank you, Mr. Speaker.
Dermot, thank you, Dermot. And can I call Michaela Hollywood Michaela will discuss Article 9 on the built environment, changing places and employment. Michaela.
Thank you, Mr. Speaker, and allow me to take a quick opportunity to wish everyone across Northern Ireland and the world a very happy International Day of Persons with Disabilities. What I will talk about today will cover many aspects of the UNCRPD, from living independently to accessibility and equality and non-discrimination. The truth is, the UNCRPD is our framework to give everyone a level playing field throughout their lives, and working towards that is essential. I am a wheelchair user, but I was also born with no ears, so I identify as deaf. When I was 4 years old, I went to the cinema with my family. I asked my elder sister, who was also a wheelchair user, while we waited on a locked door being opened for us to gain entry into the cinema, if this was the door for people who use wheelchairs. She said yes, I was right, and we needed to use a different door to everyone else. I thought about it for a moment and then asked, well, where's the door for people with no ears? I'm now 31 years old. A long time has passed. And that is a funny story, but it illustrates so well how absurd it is that any one of us should need to use a different door because our lives don't work. That cinema, unfortunately, is still the same. An absurd system where someone has to radio ahead so that I can get in what I call the backdoor economy. Even now, as a 31-year-old, I feel like a nuisance, and less than every other cinema ticket holder. As a disabled person, I'm too often directed down a back door, forced to use a service lift, and even directed through a kitchen so that I can take a seat in a restaurant. I know, though, that these businesses have the very best of intentions. I've worked with them myself. But we do still experience a backdoor economy that we should not have to. We do not need to accept that, and we should not accept that, because by accepting that, the whole world loses out, and our economy loses out. As a disabled child, my dad used to lift me out of my wheelchair if I needed to use the toilet outside of our home. He continued to do that until medically he could not do it no more. And once that happened, I could no longer use the bathroom outside of my own home. That meant if I ever did go to the cinema, I couldn't eat a treat or a snack or have a drink. And even essential nutrition like water had to be withheld. That left me with headaches, infections, and all of that was uncomfortable and nasty. And it actually got to the point where it was going to become a cost to the NHS. I was offered surgery with the risk of having more dangerous infections than I was currently having. And it was a risk I was not willing to take. But thanks to work like Christine and Alia and many others who are here with us today and who aren't, changing places are coming to the fore. And that can fix that issue for me. We are making great strides towards that, but not a single penny of public money should ever be spent on a building without a changing places toilet. And that is still happening today. As a disabled person, I cannot do even the most basic of human function without help. My personal assistants enable me to do everything, from buying off my Christmas presents to getting dressed, into the car, and being here today. But social services systems are restrictive, and they don't give me the flexibility to do what I need to do as an employer. I'm so happy to hear that we're making progress on the Independent Living Fund, which I am a recipient of. But we need to go further. Not only should we reopen it, but we should direct all funding through ILF, because they give us a person-centred and person-led approach, and they enable me to be an employer and a person. For my community of people living with physical impairments, all too often the focus is on how we are faulty. This leaves us with a skills gap. Nobody taught me how to be an employer. Never mind an employer of 12 people who would look after my most intimate needs. Nobody taught me how to advocate for my own needs. And nobody taught me how to survive and thrive when all of the systems that are meant to be there to help only serve to hinder and hurt. In February of 2022, the Global Disabilities Summit will meet. The pandemic has presented us with a massive opportunity to advance our rights, helping all of society in return. It is vital that Northern Ireland are represented there. We can do this. In Northern Ireland, the rate of disability is 5% higher than anywhere else in the world. This is the greatest opportunity for positive progress that we will ever have, and certainly in my generation. If we act now, all of society will benefit. Thank you.
Thank you, Michaela. Can I advise members that Michaela actually recently participated in an Assembly initiative to celebrate International Women's Day, and her video contribution, which is very inspiring, is still available on the Assembly website. Moving on to Speaker 6, we will now hear from Michael Johnson. Michael has pre-recorded his contribution to discuss Article 30 on access to sport, culture and leisure. Can we bring Michael's contribution onto screen, please? Can we have our recording now? Thank you,
Mr. Speaker. My name is Michael Johnson. I am deaf and I'm a British Sign Language user. In a voluntary capacity, I'm the chairman for Northern Ireland Deaf Sports, the governing body for deaf sports in Northern Ireland. Our primary role is to support local deaf clubs by providing guidance on participation, funding, competitions, and much more. Including coaching programmes. We know that Article 30 in the NRCPD highlights that participation in cultural life, recreation and leisure and sport, and it highlights the rights of persons with a disability, including deaf people, to take part on an equal basis with others in recreational, leisure and sports activities. In Northern Ireland, this remains an issue where many deaf people cannot access recreational, leisure and sports activities on par with their peers due to barriers in communication and, of course, lack of awareness among those mainstream sports clubs. And those barriers to communication are difficult and ever-present. Today, many deaf people struggle to be accepted in a mainstream sporting environment. And this is at all levels, unless they have an exceptional talent in the particular sport and are able to compete better than their peers. Therefore, participation and acceptance really shouldn't be based on talent. Deaf people want to be in an environment where they are accepted regardless of their ability, be supported and coached by individuals with the correct resources so they can enjoy playing in an all-inclusive environment. Now, there are a small number of deaf individuals and teams here in Northern Ireland, particularly football, bowls and tennis, where those players have competed at mainstream level. Some of them have been successful in local competitive level because they have had to show determination to succeed despite facing barriers in exclusion, support and, of course, communication. On the other hand, we find deaf people do showcase their abilities and talent, but in sporting events organised by deaf clubs and those deaf organisations. For example, many of our deaf athletes have gone on to represent both GB or Ireland at the Deaf Olympics, competing against other countries. This is a good example of inclusion, but we find that deaf people don't compete in mainstream sport the same. Northern Ireland Deaf Sports calls for consideration for the UNR CPD, in particular Article 30, to be part of our domestic laws. Persons with a disability have a right to participate in leisure and sport regardless of their ability. Barriers in leisure and sport can be overcome with the correct resources and the correct training in place. Let's make Northern Ireland a more inclusive place for deaf people and those deaf people who have a disability. Thank you, Mr. Speaker.
And thank you, Michael. Thank you very much for that contribution. Now moving on to Speaker number 7, I call Joe Kenny to discuss Article 11 and the pandemic response. Joe is making his contribution remotely. Can Joe be brought onto our screens, please?
Hello,
welcome, Joe.
Thank you, Mr. Speaker, and thank you to the members for organising this Disabled People's Parliament today. I'm going to share a little bit of my personal experience, I suppose, from living through what we now call the COVID pandemic. Just say a little bit about me. First of all, I'm, well, you know, my name is Joe Kenny. I'm 44 years old. I'm totally blind. I lost my sight when I was 5 years old, so quite a while ago now. I was born with congenital glaucoma, which is an eye condition. And yeah, I live with my wife and kids here in Belfast. So yes, just to kind of give you, I suppose I want to kind of do a sort of snapshot of what my lived experience was from the onset of the pandemic and lockdown, etc., and some conclusions and a few things that maybe I've learned or maybe I've come to the realization of since, and how I think that the United Nations Convention on the Rights of Persons with Disabilities needs to be implemented as soon as possible to, I suppose, to prevent such things happening again, and to, I suppose, to protect the rights and well-being of people with disabilities through things like pandemics. Which, I mean, I say all this with this, I mean, like, with the presumption that we all know that pandemics can't be planned. You know, it hit us all out of the out of the blue, so to speak. So there was things that maybe took a while to happen, which just wasn't possible to do immediately. But I want to sort of cast our minds back to March 2020, when, well, I kind of look back on it now and say when the world changed, you know, for me and my family. I live in Belfast city centre, and I can't remember the exact date of that day in March 2020, but it was the day that the maximum restrictions came in. I suppose the onset of what we now know as lockdown. I remember one morning going out to the local shop to get some milk and bread, I think, just for the for the house. And I remember turning around the corner to my local Tesco and being struck by how many people that were gathered outside the shop, as I thought. So I took no notice and bypassed them and went on about my business, and was confronted when I'm, as I say, I'm totally blind, and walked straight into the door of the Tesco, which I was used to being, it was electric doors. I was used to it opening and closing just automatically. It had been locked, of course, because they started a one in, one out system, and other regulations, and there was a full queuing system outside for shoppers. I was totally oblivious to this. No one, this had not been communicated to me in a way that I would have picked up or known about, because it was all done through signage and arrows and sort of visual means of notification. So I was greeted with this sort of closed door, presume the shop was locked for some reason, and only somebody stood by me, said, you have to go to the end of the queue, which is quite a long distance down the street. And then I had sort of to follow along this queue of course, being very anxious not to be too close to anyone. And if anyone else who's blind here can testify, following people and not being close to them is very, very difficult. But yeah, that was just an example of the kind of thing that happened. I mean, it struck me completely out of the blue. And maybe I was naive. Maybe I should have seen it coming, or maybe I should have known it was coming, but I didn't. That's the thing. And in that moment, it suddenly struck me how much our world had changed from this point on, with no end date in sight. And and as things would develop, then, as we know, into like one-way systems and arrows to tell people what to do and when to do it, all of which very visual, very inaccessible to people who were blind. And I was suddenly struck because I'd now become I was sort of locked out of certain aspects of society, and only through the kindness and generosity of others could I then participate, which is a very strange feeling when you've lived your life with a certain amount of confidence in society and the way things work, that overnight this changed, it's ripped away from you, and then you've got to start developing, as we all know, and as all disabled people will know about this, in finding strategies around problems, ways to counteract a proposed a perceived problem. For example, I remember another time, just to share this with you, I remember having to phone our local GP. Obviously, they weren't taking face-to-face appointments, so we had to phone the GP to our son had an issue with his eye at the time, an eye infection or whatever it was, and we had to. I should point out to my wife she also has sight loss. She's partially sighted, and her sight isn't very good at all. But we had to somehow take a photo of our son's eye, which is really difficult to do when you can't see, to take a proper photo, and send that to the doctor so he could make a diagnosis. I mean, I find this just incredible that something so, it was medical care and health care had been reduced to this, blind people trying to take a photo of a child's eye in order to achieve a diagnosis from a GP. And I say this knowing that, we were all faced with the pandemic. It affected us all in different ways, some more than others. And, we all had to make do and get round problems. But there was I didn't feel that the government and government agencies had ever considered what to do with disabled people in the case of a pandemic restrictions. There was no thought, from my point of view, there was no thought given to our welfare, to how we might do what we needed to do on a daily basis, like shop, like medical care and health care, like get from A to B, that kind of thing. And yes, we got through it, and we did. And a lot of that was done through the kindness and the generosity of our neighbours and friends and family. And, I'll not forget that. But it was, to me, it wasn't through the kind of, it wasn't our needs of disabled people were not included in the planning for this. And that's what I hope that the UN CRPD can go somewhere to address. The fact that should we ever face a pandemic again, and we probably will at some point, that when the planning and restrictions and all these kind of things are implemented and put in place, that people stop and go, what about those who don't access services or systems or processes in like the mainstream way, if you like? And I don't even like using that phrase, mainstream, but if consider I can't absorb information through like visual means, but there was no, I certainly felt there was no attempt to address that problem in terms of the where we were at that time. And then I just want to move on to then the question of the kind of COVID testing, and that was another. I actually caught COVID back in September 2020, and I kind of recognized the symptoms, and I thought, oh, this isn't good. I don't feel well. So I had to turn my attention then looking at getting a test, a PCR test. Well, obviously I didn't know much about it at that time, and it turned out nobody else really knew either about how a person with a disability, a blind person, might obtain a test. I tried getting a home test, and apparently there was none available. I was told to go to my nearest centre. How was how was I to get to a nearest testing centre independently? Because I didn't know where it was, so I couldn't walk to it. By asking anybody else to take me or to taxi me or anything like that was putting another in potential risk. And my wife couldn't help me because she had to stay at home with it. Obviously, she had to stay at home with the children. And this suddenly struck me again. No planning for disabled people. We were very much second-class citizens. We'd been forgotten about in the kind of the mainstream rush to put things in place for COVID. And of course, a friend did take me. He did actually put himself in risk, at risk, and he did take me to the COVID testing centre local to me, and I'll be forever grateful to him. And turned out I was positive, and yes, I did have it. So there, I mean, it just showed me that that was a very real and real life example of how people with disabilities had been forgotten about. Thank goodness I actually recovered. I was one of the lucky ones. I didn't suffer too badly, and I recovered well. But I just think even now, COVID testing is not very accessible to people who can't see. Even now, as we embark upon the implementation of the vaccination passports, I mean, I find that a particularly stressful experience getting mine sorted out a few days ago. It's not accessible to people who can't see very well. It wasn't planned with us in mind at all, and that is something that I think needs addressed promptly. I suppose I want to close my remarks by saying that at every turn we were always told that vulnerable people. I don't consider myself to be a vulnerable person, quote unquote, whatever that phrase means. I'm just a blind person who lives and works and does everything everybody else does here in Belfast. And along came out the pandemic, and we were suddenly forgot about. And it felt like nobody remembered about people who couldn't see or people who couldn't access services and systems in the kind of mainstream way. And that is something that needs corrected promptly. I'm going to leave it there, I think, but I want to thank Mr. Speaker and the members for organising this today, and thank you very much for the opportunity to speak.
And thank you to Joe Kenny for that contribution, again very important. Moving on to Speaker number 8, and I want to call Greta Kirkleg. Greta will discuss Article 25 on access to health. Greta.
Thank you, Mr. Speaker, and thank you for having me here and allowing me to share my story. When I was asked if I would like to talk in today's event, I thought automatically that I will talk about Article 27, what is employment and work, as this subject is really close to my heart and I have quite a bit of experience. But unfortunately, few other things happened in my personal life that I felt that I have to share my thoughts why UNCRPD is so important, looking from Article 25 perspective and focusing on a point B. And UNCRPD Articles 25.b states that, in particular states parties shall provide those health services needed by persons with disabilities specifically because of their disabilities, including early identification and intervention as appropriate, and services designed to minimize and prevent further disabilities, including among children and older persons. A few months ago, I was lucky enough to get a place in Musgrave Park Hospital's neurology unit and complete 2-week inpatient rehab program. In these 2 weeks, I realized how lucky I was that one physiotherapist noted how bad my mobility got and referred me to rehab. I also realized how badly I manage my condition and how small things can improve my health quite a lot. That got me thinking that maybe if I would have attended rehab 3-4 years ago, I wouldn't be in the state I am now. Neurology unit in Musgrave Park Hospital has great facilities, but we have just 3 rehab beds for all Northern Ireland. MS Society suggests that there are about 6,000 MS patients in Northern Ireland. I'm talking 6,000 diagnosed people with MS, there are much more who are not. But anyway, let's say that half of them would benefit from rehab program. If there are 3 rehab beds, a rehab program lasts 2 weeks. So 78 MS patients could benefit from rehab a year. So we would need 38 years to put all these people through rehab. And this has nothing to do with COVID pressures, as I am not talking about times when rehab beds were used for our patients due to bed pressures in our hospitals. I am also suffering from anxiety, and I'm still finding it hard to come to terms of my disability. So while I was in hospital, I spoke to doctors and was referred to clinical psychologists. A few weeks after I was discharged, I received a letter from clinical psychology services and was asked to phone them if I'm still interested in attending these services. I was all excited because I thought I will be getting help and it will improve not just my mental but physical health too. So I phoned to say that I am very keen to attend and was told that waiting time for assessment is 2 years. I am talking about assessment and not about actual sessions. A lot of things can happen in 2 years' time. You know, when you are being diagnosed with MS, what I have, one of the first things doctors and nurses advise you to do is to keep your MS under control and reduce a number of relapses is to not stress. Stress is one of the biggest triggers of MS relapses. Back in December 2013, I had a huge panic attack in Dublin Airport. After that, my MS deteriorated rapidly and my anxiety grew a lot. I was afraid to go anywhere, my mobility worsened, and eventually I had to start using walking aid. I think that if I would have got help after my panic attack and would have been taught how to deal with it, my MS wouldn't got so bad so quickly. To wait 2 years for assessment or for help regarding your mental health issues is extremely long time. Politicians like to talk about money and savings, so I am now appealing to you and say that if you would implement UNCRPD and provide disabled people with specific services within general health services, it would cost you less than paying for cares and benefits. It would take some pressure from our social care system that is on the brink of collapse too. I think that our right to health is a fundamental right. When we are denied right to health and health services, we are denied a right to independent living, education, employment, and sometimes even to life. My late mother-in-law, who was disabled, lost her life because she didn't get access to health services. And when she eventually was seen by health professionals, it was too late. My friend ended up in intensive care and stayed there for over a week because he didn't get a small surgical procedure related to his disability. Access to health services shouldn't be a matter of luck or act of someone's kindness. It should be a right that is implemented into legislation, and there should be accountability for breaching and denying this right. Thank you.
I thank Greta for that contribution again, and I now call our next speaker, Rosie Dempsey. Rosie will discuss Article 24 and 7 on children and education. Ms Dempsey is making her contribution remotely. Can Rosie please be brought onto our screen? You're welcome, Rosie. Can you make your contribution, please?
Thank you, Mr. Speaker. Yes, good afternoon, everyone, and thank you for inviting me to speak today. My name is Rosie Dempsey, and I work for our NIB in the Children, Young People and Families Service. I myself grew up with a vision impairment, and I'm well aware of the experiences that children and young people with vision impairment can have in education and with other services. But today I don't really want to speak about myself. Rather, I want to speak about the children and young people today who've come after me, who are experiencing education and some of the challenges that they can face. I'm also hoping to propose a solution that may be able to help with some of these issues to ensure that the rights of children and young people to fully participate and be included in education under Section 24 of UNCRPD can be realised. First of all, I'll give some statistics. So in Northern Ireland, there are just over 1,000 children and young people with a vision impairment under the age of 18 supported by services in the Education Authority, VI specialist services. And that makes it a low incidence disability. To give you an idea of what that means, for children and young people, they can often be the only one in their school who has who is blind or partially sighted. I myself was the only one in my school, of my secondary school, of 500 other pupils, until my brother joined 7 years later, and he then became that person who was the only one in the school who had that experience. So also, around 50% of children and young people with a vision impairment have other difficulties and disabilities as well. And the majority of blind and partially sighted children are now in mainstream schools. Some are still in specialist school provision. But the challenges for children and young people in mainstream school can remain inconsistent access to information and inconsistent availability of exams in the formats that they need, whether that's Braille or large print or electronic as well. Worryingly as well, young people aged 16 to 25 who are long-term disabled or with a seeing disability are twice as likely to be not in education, employment or training, what they call NEET for short, although that isn't really a good description of the experience. What young people told us recently at focus groups around the disability strategy, we spoke to young people aged 11 to 17 and 18 to 25, together with our colleagues in Guide Dogs. And I have put some quotes together that the young people told us specifically about education, which was one of the key issues that they mentioned. So one young person said, "It would be good if the government put more into education, especially around technology and also making the school safe to walk around." One young person who is aged 10 spoke about the difficulty she had accessing information on the computer. "The worst thing is the computers. The screens are too small. The keyboard has massive letters, which is good, but I don't know how to work the computer. And when I asked the teacher, she said she doesn't know either, so there's no help. I have to do a test on the computer soon, and I'm really worried about it." Another young person, aged 18, said, "In secondary school, I found that the teachers did not know how to adapt to an individual with vision impairment. The teachers were sometimes annoyed at having to enlarge text for me. This improved when I got an iPad for school. It made life so much easier for me." So young people with VI need specific support in order to be fully included in education. This can include access to training in Braille or other technology or accessibility features, and exams with appropriate and relevant access arrangements. And that can include extra time, practical assistance, and the correct formats, as I've already mentioned. Training in mobility and orientation, what is called habilitation, getting around independently, is key for young people. Also, emotional support and support in speaking up for themselves and being able to explain how they need their assistance to be. We can see from these examples from our focus groups that the young people didn't always receive the support, or it was inconsistent. So the sight loss sector, working very much in partnership with young people and their parents and families, are devising a specialist VI curriculum framework. And the consultation to develop this curriculum involves, as I said, parents and young people, and also specialist professionals in the field. Once established, this framework will outline the key areas of skills development and outcomes for children with a vision impairment. And it will, when it comes into place, we are hoping that it'll be provided across the UK consistently, as other countries in Europe and the world have. It's a huge development in the sector and could make a massive difference to children and young people growing up with a vision impairment. So if the Northern Ireland Assembly can incorporate the UN CRPD into our laws, the framework would be a key area to help them uphold the rights of children and young people with a vision impairment today and for the future. Thank you very much.
And thank you, Rosie, for that contribution. Moving on to our next speaker, and I call Diane Marks. Diane is here with Morris, her guide dog, to discuss Articles 9 and 21 on accessibility and information. Diane.
Thank you, Mr. Speaker, and good afternoon, ladies and gentlemen. I'm totally blind, and as Mr. Speaker said, I have a guide dog with me, namely Morris, so pardon me if you see a blonde head popping up now and again. I'm talking to you today about the lack of access to information services that exist right across the Northern Ireland private and public sectors. If I can just give you a little bit of background, 3 months ago, my partner, and I'm in a same-sex relationship, and I both moved trust areas, so from one trust to the other. Previous to moving, we were with a particular GP surgery who was completely inaccessible with regards to their information that they provided, whether that was hospital appointments, whether it was GP appointments, whether it was when actually physically being in the surgery and having the audio-visual board, which wasn't audio-visual, it was just visual, and knowing when it was your turn to go into the GP or the nurse. My partner is currently going through a lot of hospital appointments at the moment, and these are all going through the previous trust that we were with, and they have all arrived in paper format. There has been no consideration given to her disability, and she is totally blind, like myself as well. When we have approached this previous trust and have actually said to them, and this has been on a number of occasions, can you please provide that information in an accessible format, whether it is braille, large print, audio, or even in a digital format, whether it's email or an audio file that she can access. This has been not forthcoming. Now that we have moved into a different trust area, we are starting to see that we actually are getting more access to our information through, and I mean this independently, not with the use of somebody sighted, through the use of technology. This, of course, was all taking place pre-pandemic. As we are now with the pandemic, we are starting to realize that there is even greater inaccessibility to information services. This has been not only from booking online your first vaccination, which has been almost impossible because I've had to rely on somebody sighted sitting with me, going step by step through the website, which was completely inaccessible for me, let alone anybody else who was sighted, because even they were struggling, to even trying to get the COVID certificate passport downloaded. Now, I haven't downloaded it yet because I watched my partner do it, and yes, well, it was like pulling teeth, is all I can say. I believe that with the implementation of the UN CRPD, that we hopefully will be on the same footing when it comes to access to information services as any other resident of Northern Ireland. And I would be very glad to see that brought into play. I thank you, Mr. Speaker, and I thank everybody who organised this today. This is a world first as far as I'm concerned, and well done, Northern Ireland Executive.
And I thank Diane for that contribution again. And I now call on Joanne Sampson. Joanne will discuss Article 29 on participation in public life. Joanne is making her contribution remotely. Can we now bring Joanne onto our screens, please? Can I invite Joanne to make her contribution?
Thank you, Mr. Speaker. Despite the continuing controversies and negotiations alongside the seemingly endless global pandemic and worsening healthcare and climate crises, from January 2021, we moved to a post-Brexit future, a future in which disabled people are no longer in the position to benefit from EU protections and support, nor a classified group under the UK Human Rights Act, although we are, some might assume, able to avail of such a law via gender, for example. However, the reality is very different. In reality, the exclusion of disability meant that concerns regarding society violating and failing to recognise that disabled people have the same human rights as everyone, regardless of capacity issues, became apparent despite the Disability Discrimination Act. By 2006, the United Nations Convention on the Rights of Persons with Disabilities was deemed necessary to promote, defend and reinforce the human rights of all persons with disabilities. A rights-based approach towards disability was strongly reflected by the UK's updating of the DDA in 2006 and the signing of the UNCRPD in 2007, followed by the ratification of the Convention in 2009. However, at the level of international treaties and law, there is often gaps between the policy rhetoric and the everyday experiences of disabled people, as you've heard today. That is why it is fitting that today, December 3rd, 2021, the International Day of People with Disabilities, it is fitting that we utilise today's theme within the first Disabled Persons Parliament, the theme of leadership and participation of persons with disabilities toward an inclusive and accessible and sustainable post-Brexit-19 world. To demonstrate a collective leadership within our first preliminary session, to ensure that a commitment is made to create an inclusive, accessible and sustainable future by calling on the ministers to confirm that from today the elected executive and assembly members guarantee that before the end of the current mandate, domestic laws of Northern Ireland are tabled for amendments to safeguard that disabled citizens of Northern Ireland continue to receive equity of freedoms, rights, equality and dignity through the affirmative actions pertained within the Convention to ensure that we have protections we can no longer claim via the EU. To clarify why this is important, at the beginning of the current pandemic in early 2020, the UK government may have succeeded in issuing do not resuscitate letters to disabled people via GP practices, firstly in the mainland. If the EU and World Health Organization had not supported disabled people by deeming such actions unlawful. With this in mind, it is imperative that the Executive and Assembly Ministers commit to ensuring we have the protections we had as part of the EU included in our domestic laws as a matter of urgency. We disabled people need inclusive laws, protections and affirmative actions in place to ensure we move hopefully from the crisis of COVID-19 to face the many emerging challenges ahead together, that disabled people are not again the hardest hit of society. As you debate the issues raised here today, do so with this simple truth in mind. Disability does not discriminate. It is not an exclusive marginalised group that one is born into, but rather one that is fully inclusive. For many reasons, any member, as you've heard today, of our society can become disabled at any stage of life, regardless of their background, health, economic or social status. As the following stats highlight, approximately 8% of children, 21% of voting age adults and 44.5% of adults over 60 disclosed disability. These numbers reflect citizens that should have their freedoms, rights, equality and dignity reflected and upheld in law. 12 years after the ratification of the Convention, this shouldn't have been reliant on EU protections. It is timely in the Build Back Better pandemic era that Stormont steps away from the party politics of the past and demonstrates a clear commitment to the present and future of all citizens by fully embedding the ratified UNCRPD into law and putting words into action. By building on today and truly engaging with everyone in a co-produced way, ensuring that every voice gets heard, respected and actioned in future outcomes, and together begin the work of eradicating systematic oppressive practices hidden behind policies and procedures that are reflective of outdated laws, such as the 1978 Chronically Sick and Disabled Persons Northern Ireland Act. This would demonstrate a commitment worthy of our votes in the pending election, and also show and demonstrate a commitment from the Assembly to reinforce the acts of the UNCRPD and show wider society how this can be achieved. Thank you, Mr. Speaker, for the time today.
And thank you, Joanne, for yet another very important contribution. And I call on our next speaker, Ronnie Patterson. Ronnie will discuss Article 15. Ronnie.
Yep. Thank you, Mr. Speaker. I'd like to discuss community care. In Muckamore, 40 years ago, there was 1,000 patients, but today there's only 56, and that's still too many patients in Muckamore. And I'd like to say community care is the best way forward. And I'll name you a couple of good organisations. Keen's Court Nursing Home is a good organisation, Praxis, and Strickland's is a good organisation, and so is Blair Lodge, a good organisation. They're all good organisations for people to go to. So I'd like the Assembly to move on and try to get more people out of Muckamore. And and put more money into community care and make community care, instead of putting money into Muckamore, take it out of Muckamore, put it into community care, because community care is the way of the future. It's the way ahead. So thank you, Mr. Speaker.
Thank you, Ronnie, for that very succinct but important contribution. Our Speaker 13, I call Jackie Robbins. Jackie will discuss Article 13 on access to justice. Jackie.
Thank you, Speaker. My name is Jackie.
Jackie, could you move that microphone just closer to you, please?
Sorry. With people with learning disability should be able to talk to somebody if they need help and be able to ask the police for help so that the police can understand what the person is trying to say. It is important that we all have assistance to things as equal and to be fair for everyone. People who are helping need to have training on how to talk to people. Maybe like someone who has no speech or cannot talk very well, or who gets nervous and worried. People should be able to have someone with them to help who can understand them. People with a learning disability should not have to worry about getting help from the police and should be happy to go to them when they need help. Governments need to understand that not everybody is the same and that everyone needs help differently. Maybe with getting a lawyer or something. Everyone who works in this job should be trained on how to help and support people with a learning disability so the people is happier and more confidence, and if they are in a police station they can have somebody with them. Things should be written in different ways for people to understand, in a picture form or bigger letters, and maybe someone who knows sign language. I think it is very important for all in the government to know that we are all people just the same and should be getting the same rights as everyone else, equal as we are important people too and need help sometimes. Thank you.
Thank you, Jackie. Thank you very much for that contribution. Again, another very succinct but very important contribution itself. Our 14th speaker I call Alison Lockhart. Alison will discuss Article 9 on accessibility and transport. Alison.
Mr. Speaker, ladies and gentlemen, Article 9 of the UN Convention for the Rights of People with Disabilities refers to accessibility. It reads, to enable people with disabilities to live independently and participate fully in all aspects of life, to ensure people with disabilities have access on an equal basis to others, the physical environment, to transportation, to information, to communications, including information and communication technologies and systems and other facilities and services open to or provided to the public in urban and rural areas. These measures shall include identification and elimination of obstacles and barriers to accessibility. The article covers many areas of accessibility. For my purpose today, I'm going to concentrate on my experience of public transport as a wheelchair user and why it's important to have access to reliable and affordable public transport. I've been disabled all my life, at first using a manual wheelchair and then, due to health issues, a powered wheelchair, which meant until recently I've had to rely on wheelchair accessible public transport because I could no longer transfer out of my chair onto a seat or into a car. There are several options for accessible transport, each with their own issues if you use a wheelchair. Translink buses. Translink have gone a long way to improve access for wheelchair users. Low-floor buses are available largely in Belfast and other towns. There are still problems finding suitable bus stops for ramps to deploy so that the wheelchair user can gain access to the vehicle, and the dedicated space on board is often used by other passengers. Outside of towns and cities, high-floor vehicles are still being used with poor accessibility. In summary, it is still difficult for the wheelchair user to decide how far they can travel by bus and on which buses have wheelchair spaces available. Travelling by train has also improved, but not all stations are staffed and not all stations have wheelchair access. Because of this, wheelchair users can be required to give 24 hours notice to make some journeys. Disability Action Transport is another option for disabled people. However, on this service, trips must be booked a week in advance and you must travel within a limited geographical area. You can't always get the times you want when you try to book. For example, pre-pandemic, I couldn't book it to take me to work because I must be in the office and ready to work at 8:30. The service is not available at this time. Funding cuts have meant the service is only available 9 to 5, Monday to Friday, with no service at the weekend. Again, very limited. None of these three options give the wheelchair user spontaneous travel like everyone else. Before the pandemic, the most suitable and easiest form of public transport for me to use as a wheelchair user was accessible taxis, which I used quite successfully for many years, which allowed me to get to work, to have a social life, and to have a voluntary life. Quite a lot of my income was paid to taxi companies and a couple of individual drivers. For a number of those years, I used a small family-run company, which was then sold to a larger company that bought over all the smaller firms in the area, leaving no competition. To give context, a 12-mile trip into Belfast at fare and a half would usually cost me about £50 per one return trip before anything else is paid, whether it's a meal or a trip to the cinema, etc. However, there was a review of the fare structures, which included removing the automatic fare and a half for wheelchair accessible vehicles. The result of that review? Accessible taxis were withdrawn from disabled people. You could not book one, you were told there were none available. In my case, services were withdrawn via a drunken voicemail left in the middle of the night telling me I needed to get someone else to take me to work because he wasn't doing it anymore. As you can imagine, I was very stressed because I had no other way of getting to my job and the taxi firm was ignoring my calls. Like everyone else, I have responsibilities and bills to pay. One of the individual drivers had agreed to take me to work, but because one driver couldn't take me everywhere I needed to go, ultimately my family and I knew we had to find a long-term solution. So with my family's help and the ongoing support of them and close friends, I am able to have and use my own accessible vehicle. But not everyone has the same support that I have. I know that friends were and still are having the same issues as I was. I still find it hard to believe that taxi services could be removed from one section of the community and so easily and nothing could be done. Over 20% of the population of Northern Ireland has a disability. Without a fully accessible transport system, disabled people find it more difficult to move around, to work, to shop and contribute to the economy, and to have the same freedoms as the rest of the population. An accessible society helps everyone, and I would encourage you to include Article 9 in legislation. Thank you.
And thank you very much, Alison, for, again, very important contribution indeed. I now call on Minister Declan Kearney to respond to the debate, and the Minister will have up to 15 minutes.
And good afternoon, everybody. And I am delighted, but very, very humbled to have had this opportunity to address the inaugural sitting of the Disabled People's Parliament here in our Assembly. Go buíochas leis an Ceann Comhairle, agus forann siga a socht an obair sacu leis an Channel Shaw a chur ar bun. I'd like to thank the Speaker and the Office of the Speaker for working with representatives from the disability sector in organising this event. And I want to pay particular tribute to yourself, Ceann Comhairle, for the respect that you have shown to these citizens in our society by organising this event, the respect and the dignity that you have shown to the rights, the entitlements of everyone here who have participated today and who have given such powerful testimony to everyone else that you represent within our society, to all of the organisations and everyone here who's been involved. Thank you for your time and the energy in making the Disabled People's Parliament happen today. And to all of you who had the courage to speak in person and virtually, and for the time and the care that you took to prepare your remarks, I'm deeply grateful for all of that endeavour. I also want to go further and recognise the significance of this Parliament, because the importance of creating a shared forum for disabled members of our community to use your voices, their voices, cannot be overstated. And to reiterate my point, thank you to all of you who spoke for the power of your testimony and for the insights that you have shared. I think I can say, Ceann Comhairle, that if this is not the most important debate, it is one of the most important debates that I have ever borne witness to and contributed to in this Assembly. And I think that is something that needs to be heard leaving this Assembly today. one of the most important, if not the most important, debate that has ever taken place in this place. You see, rights which are delayed are rights which are denied. And it is my view that when that happens, nothing should get in the way of ensuring that those rights are delivered on. At a personal level, as a constituency MLA, as well as a minister within our executive, I can tell you that listening today to all of your contributions will steel my resolve in how I continue to advocate for constituents of mine who are living with the circumstances and the challenges and the denial of rights that all of you have given voice towards. I will go back into South Antrim next week, I can tell you this, and I will double down on my commitment to act on behalf of those constituents who have come to me and asked for support in terms of the whole suite of issues that you have spoken of today. Lóir sibh ón chrí, lug sibh amach na dúchlein a taróine go léir, mar folatóirí agus mar hiaraní. And I want to respect your humanity and your courage. And I also want to acknowledge not just what all of you have said on behalf of those that you represent as activists, but I want to acknowledge your husbands, your wives, your partners, your friends, those who live with you, because they live with your experience also. And many of you have spoken about how important the contribution has been of your partners, your spouses, your siblings, your family, in ensuring that you have been able to come here today to speak out and to give voice to your experience. What's been said today resonates very closely with my own family experience. My own son is autistic. He has many cousins and I have many nephews who are also autistic. But Faker also has additional learning disabilities and he lives with extreme anxiety. He has all of that to manage. He's a very bright, clever young man. And he has a really valuable role to play in making our society a better place, just like each one of you. But his life is very challenging and it's very complicated. And not everybody sees or understands his realities. And that is why what all of you said today is important for those who are listening and who are viewing. You have pulled down the screens which gives access to our society to see everything that you must contend with within your lives. The challenge, from my perspective, in navigating my son's path towards independent living is extreme. So I can tell you, and I can relate to everything you have said. For someone like me, I've been pushed from pillar to post. I know when I hear what all of you have said about the challenges and the difficulties you experience, that that is the real world for each and every single one of you. 1 in 5 people here in the North live with a disability. So it's essential that we give voice to and support everything that you have to contend with. We have to ensure that the future of our society and that of future legislation and public policy reflects the needs of disabled people, and everything that you have said today. Many contributions have been made here at Cloncorlia. It would take me more time than you will permit to address the comments that has been made. But Tony O'Reilly opened up this debate by making the very, very salient point that the inclusion of disabled people is a human rights issue. That is a universal reality on this island and in this region, and that must be addressed. Amanda Paul, who spoke so powerfully about suddenly becoming disabled, and then losing her independence. I was deeply moved to listen to how Christine spoke of Lilia's experience and the lip service that is paid to the needs of disabled children. Dermot Devlin, Michaela Holyrood were so eloquent in the experiences that you shared with us. And yes, Michaela, the CRPD is about a level playing field, and it's not good enough to be told to use the back door. Michael Johnston told us about how he has been pioneering work in relation to deaf sports and the importance of ensuring that those barriers in sport and recreation are overcome for our deaf community. And Joe Kenny, I thought, brought a really sharp focus to the reality of the pandemic and how disempowering and isolating it has been for those who have sight loss. Greta Gurkleit, I thought, set out very, very clearly the challenges of those in our society who live with MS. And all of that stress, the panic attack, the implications of that for mobility, and then being able to put it all so crystal clear. Access to health and social care in this society should not be about luck. This is not about a lottery. This is about access to fundamental human rights. Rosie Dempsey spoke about the rights of partially sighted children and young people and the need for them to be fully included in education. Diane Marks addressed very clearly the need for accessible services for people without sight. And Joanne Sampson was very, very challenging and brought a challenge function to this debate by making it clear that the challenge here for this Assembly, for our executive, for this society, is to secure and guarantee the protections under CRPD for disabled people in an inclusive post-Brexit world. Ronnie Patterson spoke about a place I know well, Muckamore. And thank you, Ronnie, for making the point that we must invest in community care. And then a Cion Corlia, Jackie Robbins, talking so well, Jackie, about the needs of people with learning disabilities and the importance that the police and the criminal justice system, but all public services, need to have in terms of addressing the care that is needed and the compassion to understand and to properly engage with people, for people with learning disabilities. And finally, a Cion Corlia, Alison Lockhart, who spoke about the experience of physical disability and the need to having fully accessible transport for all people with physical disability. Cion Corlia, these are such important issues. And what I would urge all of you as activists and representatives to remember is that there is an election in May 2022. Let's make these issues an issue in the forthcoming election. Speaking to you today on International Day of People with Disabilities brings into focus how important this Parliament is, not only for those of you living with disability, but for every citizen and sector in our society. And the theme of this year's celebration is, hear this point, fighting for rights. Fighting for rights in the post-COVID era, and that is what we must do, Acharja. Following through the struggles that the pandemic has created for everyone, this theme could not be more appropriate. And over the last 2 years, the global pandemic has only widened levels of inequality in our society, and that is particularly true for members here who live with disabilities, who have already you have already been living with institutionalised inequality and discrimination. Through our shared and our personal experiences, we have seen the level of inequality deepen with respect to accessing services, education, healthcare, the criminal justice system, and many other parts of daily life. I believe that disability inclusion must be integral to a truly rights-based society here in the North. And we must work together to ensure that the barriers which exist are not perpetuated for disabled people, which block your full participation in every walk of life and in public life. Ní mór dúin a chion cóirle, coibre le chéile chun gach sais bach agus idir yalu a haru. This Parliament is a new and a powerful platform for people with disabilities to promote the message, friends, that our society must become a no-go area for disability discrimination, exclusion or marginalisation. And we as an executive must be committed to upholding the rights of all of you. We're very open, Achon Corlia, to taking part in the conversation about potential incorporation of the United Nations Convention on the Rights of Persons with Disabilities into law here in the North. Our Department for Communities is already taking work forward in relation to co-design through an executive disability strategy which would address many of these issues. And the Disability Strategy Expert Advisory Panel has already recommended that we look at how the CRPD could best be given legal effect here in the North. And the panel has recommended that a legal scoping study should be commissioned to identify and compare the benefits of and models for incorporation of the Convention into our legislation. It is also recommended that proposals be developed for public consultation. Members of the Disability Strategy Co-Design Group have subsequently called, and you'll be pleased to hear this, full incorporation of CRPD into domestic law. And I support that position, Achon Corlia. Curram sa fáilte revision gahil agus gahomlan. Any decision on what would be included in that strategy, and indeed any consideration on the full incorporation of the Convention into legislation here, will be a cross-cutting matter involving all departments. But Acharja, we need to ensure that the rights framework here will meet international standards. They must meet the needs and the expectations of every single one of you and all people with disabilities. And your collective involvement in that process is essential. I and we appreciate everything that you do to protect and advocate and represent and give voice to the needs of people with disabilities. Thank you for your time today and for your inspiring messages. Thank you for letting us hear your impatience for change. Thank you for demanding that the doors are open and that we create the access. As I said earlier, Achon Corlia, to conclude, rights delayed are rights denied. There should be no legislative impediment and there should be no price tag attached to how we secure the human rights of disabled people. Acharja, together we will make sure that the rights of disabled people will be enshrined and protected. Níneart go curla céile. Finally, Mr. Speaker, this is the first Parliament of disabled people. I hope, trust and urge that it is not the last. Thank you, Mr. Speaker.
Thank you to the Minister, Kearney. I want to call our next speaker, Ms. Andrea Brown, to wind and to conclude on the debate. And Andrea has up to 10 minutes.
Thank you, Mr. Speaker, and thank you every single one of you that have spoke today. It's been extremely powerful listening and waiting all this time to speak. I feel like just ripping my own notes up and just leaving it at that. But it is a real privilege to speak here today in this inaugural and now groundbreaking Disability Parliament. I want to thank everybody who supported Mr. Speaker, yourself, to Louise and the engagement team. Thank you so much for this. Has been a long journey to get us here, but we're eventually here, and it's wonderful, and it's been a wonderful event. Minister Kearney, I want to thank you for your commitment in your speech there to deliver human rights in your own constituency, and we want other MLAs to take notice of that and to do it, and also in theirs. I suppose, you know, I'm a local East Belfast girl. You know, as a child, I played in the grounds of Stormont, really not knowing what went on in this big white house in the hill. You know, my friends and I, we picked up our backpacks, came down here for the day, run round, play football, swung in trees. But little did I know that those freedoms aren't afforded to everybody. And as Christine McClements very eloquently put it, you know, all children should have the right to play freely, and so therefore all play spaces should be accessible. But how wonderful now that this chamber is filled with deaf and disabled people bringing their issues to politicians in this public forum, and I am really honoured to be playing a part in that. So you've been hearing this afternoon about the responsibilities of this Assembly under the Articles of the UNCRPD. My colleague Tony O'Reilly opened up by explaining how this convention sets out in its articles your Assembly's obligation to all the deaf and disabled people in Northern Ireland. The governments of these islands have ratified this convention. Therefore, it is imperative that this Assembly listen, that they take action, and that as is presented in the motion today, that they fully incorporate the UNCRPD into domestic legislation. And I really welcome the Minister's support for that. And also that you give direction to your civil servants that consideration be given to the Convention in policy development and service provision, and that they mainstream disability into every facet of public life. Only then will we truly see an inclusive society where everyone is equal. This inclusion to date has been sorely missing. You've heard today, as I've said, from deaf and disabled people about their experiences of their rights, either confirmed or not, under the Convention. I have scribbled a lot of notes that I was going to say and mention everyone's name, but I have to again thank Minister Kearney for covering that for me and doing that in a very genuine and powerful way, and we welcome his support. The New Decade New Approach Agreement, which saw the reinstatement of this institution, requested that the programme for government was underpinned by a disability strategy. Now, significant work has been undertaken by the Department for Communities, which has the potential to develop a credible strategy which could have a significant impact on the lives of deaf and disabled people. However, this needs to be backed up with resources and tangible commitments to change. Change with respect to eradicating inequality through the removal of barriers and prohibiting discrimination. Brexit continues to present challenges to this region, and while there is a commitment to the non-diminution of rights in the context of Brexit, the resulting instability and disruption emerging from Brexit has already had a negative impact on deaf and disabled people, and the full extent of that is not fully known. But we will monitor this closely. But today, which is the 3rd of December 2021, and the 3rd of December is always marked as a day of celebration, it is tinged with some sadness this year. You know, the theme is leadership and participation of persons with disabilities towards an inclusive, accessible and sustainable post-COVID-19 world. And COVID-19 has deepened pre-existing inequalities, exposed the extent of exclusion and highlighted that the work on disability inclusion is imperative. There are 1 billion people in the world with a disability. That's 15%. And as with lots of things in Northern Ireland, we backed away above the average on that one. There are 20% of adults in Northern Ireland with a disability. That's 1 in 5. And they're one of the most excluded groups in society and are amongst the hardest hit in this crisis of fatalities. So 2/3 of people who have died to date with COVID-19 had a disability. So I'm just going to repeat that. 2/3 of people who died with COVID-19 had a disability. And today we remember those who lost their lives to COVID-19. And that may have only been the tip of the iceberg. Many, many people died in care settings who were not tested and who did not receive appropriate medical interventions because of their disability. And as Joanne Sampson highlighted, the scandalous process of enforcing DNR notices. And many people still today, and many people in this room, this is their first day out, we're still being advised to isolate due to compromised immune systems. We must learn the lessons of this pandemic. And the UN Convention implores us in Article 11 to make all the necessary measures for the protection of disabled people in emergency situations. Now, the Executive have produced a COVID recovery plan, but one which fails to address the issues of people with disabilities, which even fails to mention the word disability. There is nothing to fear in the word being included. It seems to be replaced by vulnerable, and I think everyone in this room will agree that that is not what they are. It talks of tackling inequalities, and where the outcome for that is to have an inclusive society where people have equal access to opportunities. So let's do that. Let's have that society. It'll come through brave leadership, through truly engaging with deaf and disabled people, through breaking down those barriers, and with dignity and with respect for disabled people. So we, today, as disabled people, we look forward to engaging with the Executive and the senior politicians in the new year to address the many issues raised here today. And we look forward to reporting back at next year's second Disability Parliament. Thank you, Mr. Speaker.
Thank you, Andrea. And having listened to your very comprehensive conclusion of this particular debate, we've learned a lot. And that's, again, very, very important for the purpose of this afternoon. But we also now know he was running about the grass a number of years ago with yourself and a few of your mates. But so the question is, members, that the motion standing on the order paper be agreed. All those in favour say aye. Aye. All those in favour contrary? No. No. So I think the ayes have it, members. The ayes have it. That means that the motion is now agreed. Thank you all very, very much for that. And that concludes this particular session of the Disabled Persons Parliament. Just on a few remarks to conclude this afternoon. First of all, I would like to thank the Junior Minister for taking time out of his schedule to be here on behalf of the Executive. Thank the Minister for that. It has indeed been a great pleasure to see in person the passion, the emotion and the vigour with which the Disabled People's Parliament is fighting for the issues that matter to disabled people. Having listened to your concerns this afternoon, it has highlighted how important that it is for this Assembly to connect with the community that it represents and to listen to and address your concerns. That is why I would encourage you to keep on with your work, the very invaluable work. Despite all the challenges there are and that you face, I do congratulate you all for engaging with the democratic process as well. I also congratulate everyone on the work that has been done through the Disabled People's Parliament. Keep at it, and I include in that the members who are here today, the various organisations who are supporting disability rights, and the Assembly officials who have been named earlier on. So I wish you every success for now and in the future. And that brings me to the last item on the agenda, which is the one that most LMAs appreciate, and that is the adjournment. So order now that we now move formally to close our proceedings in a normal way through the adjournment. The question is that the Disabled People's Parliament do now adjourn. The Parliament is adjourned, and thank you all very, very much indeed. Thank you. Safe home.